Colposcopy is a device with high definition camera to visualize vulva, vagina and cervix. It's more accurate, which helps you to diagnose so many conditions like inflammation of the cervix, cancer of the cervix in an early stage. So it's very useful to detect the cancer in an early stage. Then coming to the magnitude of the problem, cancer cervix is the world third most leading cause of death in female cancers, next to breast cancer and colorectal cancer. So it's very important to diagnose cancer or to detect in an early stage. Precancerous condition of the cervix can be detected by colposcopy by identifying the transformation zone. Actually, vagina has a squamous epithelium, that's inner lining, and the cervix has got columnar epithelium. The transformation zone is very important because all the malignancies start in the transformation zone. So if you detect this stage, at this stage, it is very rewarding because the cancer survival or it can be prevented to go into invasive stages of cancer. So it is a lot of benefit by detecting the early stage. Cancer survival is 5 years if it is detected in an early stage. If it is detected in a late stage, cancer, only 50% of the ladies will survive for 5 years. So it is important to detect cancer in an early stage. So who needs colposcopy? It cannot be used as a mass screening method. Initially, we use pap smear, that is just a smear to detect the early cancer. If there is suspicious in the pap smear, and number 2, if a HPV infection is detected along with the abnormal pap smear, and these cases are subjected to colposcopy. Coming to the procedure of colposcopy, as the part is exposed and it's cleaned with a normal saline, and then acetic acid 3 to 5% is applied to the cervix, which dissolves the mucus, and then Lugol's iodine is applied, which stains the normal tissue, and thereby it helps to detect the abnormal tissue. So it is this is how it works, and we can identify these cases. So colposcopy is a simple procedure done in an outpatient base and doesn't require any anesthesia. The diagnosis is most accurate up to 99% for cervical cancer. So it depends on the detecting the transformation zone and study of vascular features and color change with the Lugol's iodine. So the sensitivity of this test is 99%. Coming to any risk factors, hardly like any other gynec procedure, bleeding and infection, and the contraindication is pregnancy. So otherwise it is really a very useful tool in a suspected cases. Risk factor for carcinoma cervix is multiparity and compromised immune system, and more important is HPV infection. So it is more common amongst adolescents who are exposed to sex in an early stage, and multiple partners, smoking and behavioral problems. So these adolescents have to be vaccinated against HPV. It is given in 3 doses, 0, and the second dose after 1 to 2 months, and the third dose after 6 months. So it protects up to 90% of attaining to developing cancer cervix.